welcome. My name is Agustín De La Mora. Thank you for joining us today to participate in this How to Become a Medical Interpreter presentation. As I said before, my name is Agustín De La Mora. I am a federally certified court interpreter, but I'm also a certified medical interpreter by the National Board. And we're going to talk today specifically about how to become a medical certified interpreter and why is that important. So I would like to share with you, first of all, my personal story. How did I become an interpreter? Who am I and what am I doing here and what I am attempting to do with this presentation. I came to this country 30 years ago with a degree in psychology, and I wanted to work in the field of psychology, but probably it happened to a couple of you when you came with a degree from another country, you find certain difficulty in being approved or being concerned or accepted as a degree holder from another country because accreditation is a little different in this country. So I needed to have a job, and one of the things that I had done in the past is I had been a Berlitz teacher. I taught languages in Mexico City, and Berlitz had a school in Tampa, Florida, where I was living, so I immediately applied there and I was accepted as a teacher of languages. And while I was teaching Spanish, one of my students, who happened to be an attorney, requested that I be his interpreter for a deposition. And I was approached by my supervisor, who told me, one of your students wants you to be an interpreter for a deposition. And I asked him a very important question, and that was, what is a deposition? At that point, I had no idea what a deposition was. I had never been in a court of law in the United States, and all I had seen at that time was Perry Mason or something like that on TV. Anyway, because the pay was better than teaching, I accepted the assignment and I went to interpret for this gentleman attorney. And while I was interpreting, I learned my first lesson of interpretation, which is to use the first person, because my first answer or my first interpretation was, she says that her daughter and her sister, and of course that was confusing, so I was introduced to first person interpretation. I was then sent to the courts because this attorney told me I did a good job, and I went to the courts. I really don't know how he knew I did a good job since he didn't speak Spanish. So, but anyhow, I went to the courts and I applied to become an interpreter and was granted an interview. And funny enough, after a couple of questions, the person who was in charge asked me to come the next day. I assumed for a second interview, but instead he put me in a courtroom and he said, that's the judge and that's the attorney and that's the person who needs interpretation, good luck. And he sent me on my merry way and said, well, come see me after you finish. So that's how I was introduced to the world of interpretation in the United States. I was really not prepared, but very fortunate because there was a lot of people there that were already into interpreting. They studied, they had a group, and they talked to me about something that was very new at the time. It was interpretation certification by the federal government. And we as a group started studying interpretation. And very quickly I realized that I had no idea how to interpret, and I probably shouldn't have been in that court that day because I really didn't know what I was doing. But because we were interested, we started learning and getting introduced to the world of interpretation. And with my background, especially in learning and teaching, I discovered right away that the most important thing about interpretation was to know what we were doing. And I was lucky because my father was a physician and I had worked for him in a hospital for many years. So I had quite a bit of knowledge of medical procedure and vocabulary, and I shortly after court interpretation discovered medical interpretation. So now fast forward to the next 20 years and the changes that we have seen in this country. So I'm going to share with you a little PowerPoint that I prepared for you so we can all follow up what I'm talking about. As I was saying, when I became an interpreter, my experience was first in the courts and then in hospitals. And I have been working as an interpreter for many, many years. What I wanted to share with you is the experiences of what happened to me when I first started and what I'm doing today as an interpreter. I became an interpreter, like I said, almost by default, and I'm sure that many of you are thinking the same thing. Well, that's how I started. Somebody asked me to help them in a hospital or something like that, and because of that, I became an interpreter. So, but the difference is that as time has gone by, certain things have changed in this country, and one of them is, what is it that is needed or required for a person to become an interpreter? In the past, when I started in this business, the idea was, okay, Agustin, you speak Spanish? Yes. Can you be here tomorrow at 6? Yes. Boom, you're in. You were the interpreter. But after that, we started understanding, and people that were using our services started discovering that not all interpreters are created equal. But most importantly, that there was mistakes that were being made during interpretation that could be pretty serious. I mean, obviously, in the medical field, if I confuse the liver with the kidney, that could be a terrible thing to happen to one of our patients. So obviously, we need to have certain specific qualities to be interpreters. And hospitals, through a little bit of learning, and to be honest, also the risk of being sued, have started developing programs and demanding that people get certified. So I'm happy to report that now most hospitals are trying to improve the quality of interpretation by demanding that their interpreters become certified. And that is why we're here today, to help you in the process. If you're interested in becoming a certified interpreter, how do you get from where I started, which is I'm a bilingual person, I want to interpret in court or in the medical field, I want to go to doctor's visits. How do I get from where I am to where I need to be, which is certification? So these are certain qualities that you must have as an interpreter. First and foremost, you must be able to transfer accurately from individuals with high levels of education and large vocabularies, meaning usually the healthcare providers. You know, doctors have sometimes the bad habit of using very complicated terms when they're explaining something, or maybe the medical terms, the parts of the body, the systems, even the names of medicines, they are referred to in very formal ways. So of course, they have a vocabulary that is what we call high register vocabulary in English. We have to be able to transfer that same level of vocabulary into the other language at the same level. On the other hand, we might have the opposite. We might have a patient maybe that is a young kid or is a person who doesn't have a high level of education, and they're going to use more colloquial terms. They'll refer to their tummies as opposed to their stomach. They might say backside instead of the appropriate term in medicine. So we have to be able as interpreters to navigate both sides of this equation. Low register, more colloquial, or more scientific vocabulary. We also have to have very good public speaking and interpersonal communication skills. Why? Because we mediate. One of the interesting things about being an interpreter in the medical field is that you are not only a conduit. As you get more educated in this field, you know that you go from conduit all the way to maybe sometimes even the advocate for the person you're interpreting for. And therefore, your communication skills are very important, so you maintain a level of engagement from both parties that you're interpreting for, from good enunciation, pronunciation, but also to make people feel comfortable and confident in your performance. You also have to have the mental toughness to hear some traumatic, shocking, difficult things to hear in a medical case. I have to tell you at the beginning, it is tough when one of the doctors is communicating to one of the patients, for instance, that they have a terminal illness, and there's really not much that they can do, or they need a very difficult, complicated, and dangerous surgery or something. It is something that you have to be prepared about, because you don't want to transmit your feelings with the communication of the interpretation. And you must be studious, because as an interpreter, one of the things that I love about interpretation is you're never going to stop learning. There is no time. I've been doing this for 30 years, and at no time have I thought or felt, that's it. I've learned everything I need to learn about interpretation in the medical field. We're always going to be learning new things. So from the time I started, when I was an interpreter, as I said, the request was very simple. Do you speak the language? Can you be here tomorrow? That still is happening, but less and less. Now, most companies that hire interpreters, most hospitals, most doctors are starting to ask the question, are you certified? Or are you qualified? Have you been prepared to do this job? And not only are you a bilingual person. So now we have certification in place. We have in this country 2 national certification bodies that certify medical interpreters. And I am very happy to be member of the associations that generated these bodies and to participate in their meetings and conferences every year, because I really truly believe this is exactly what we needed as interpreters. We needed a guide. One of the things that I remember telling people is, when I started as an interpreter, I wish somebody had told me, okay, so what is it that I'm supposed to do? What if a person tells me something in confidence? What if I don't understand the term? Do I make it up? Do I guess it? How do I deal with this? What if the doctor is speaking too fast, or the person has like expressed to me that they really don't know what's going on? Should I interrupt the doctor or should I not? All these questions came to me, and I wish I had somebody to tell me how to resolve these issues. Well, now we do, because in order to become certified by one of the national certification bodies, you do need to have training. So there are, as I said, 2 national certification bodies. The first one I'm going to mention is the NBCMI, National Board of Certification of Medical Interpreters. This is the board that certified me as a certified medical interpreter, and that is the website where you can go and get the information required to become a certified medical interpreter. And at the end, if I have time, I'll even show you their websites. The other body that we want to talk about is called CCHI, the Certification Commission for Healthcare Interpreters, and that's cchicertification.org. Those are the 2 recognized bodies in the nation that certify medical interpreters or healthcare interpreters. I want to make this very clear, because there is some confusion out there because there's not enough information, and many people think that they are certified because they didn't understand the process when they, for instance, went to a school and got a certificate as an interpreter or translator from a university or community college. That is a certificate program, but it's not a certification as a medical interpreter or a healthcare interpreter. Unfortunately, that has been compounded by some companies not being very clear with hospitals that hire them, and letting the hospitals kind of infer, even if they don't say it out loud, that their training equals certification, because people get a certificate. And I've heard people say, I'm certified by Bridging the Gap, or I'm certified by this other organization. I just want to make it clear to everybody here that to be a certified medical interpreter or certified healthcare interpreter, you must be certified by one of these 2 bodies, nobody else. And how do you get certified? Well, the requirements are pretty similar. And one of them, and one of the ones that I really, really like, is both organizations demand that in order to be a certified interpreter by their organization, people have to take a 40-hour training, at least. In other words, they have to have had 40 hours of training before attempting to take their exam. And this is quite important, and I think it's very commendable from these organizations that they demand this up front. Also, people have to have at least a high school diploma or the equivalent from another country. So these are the minimum requirements by NBCMI or CCHI. Now, some people tell me, well, that's great, Agustin, but is this a good career? Well, I believe so. When I started in this business, because anybody could do it, salaries were nothing to brag about, and I don't think they're still where they should be. As we progress as a recognized profession, as we can prove to the people who use our services that we are prepared and that we can command good salaries, I think salaries will improve. But as of 2014, the growth projected in the next 10 years after that is 29%. If you think about it, that is one of the fastest growing professions in the country. And this growth is definitely due not only to demand, but to the understanding that when people need somebody to communicate with a person that doesn't speak their language, whether it's a doctor, a nurse, or any kind of healthcare provider, no longer is it acceptable to use their daughter or their son or their cousin or the neighbor, or even somebody that works in a hospital as part of the staff instead of having a professional interpreter, because after all, they wouldn't recruit the patient's sister who happens to be a nurse. They wouldn't recruit her to provide nursing services to the person. They would say, hey, we have our nurses that are protected by our hospital policies and rules and regulations. We'll use that nurse and not your sister, even if she's a nurse. So because the hospitals and the doctors and the insurance providers are changing from being just anybody who speaks the language to a professional interpreter, the growth is going to continue for the next 10 years. And I probably not at the rate of 29%, but pretty high still. Now, urban areas, of course, will continue to provide the largest numbers of jobs. Why? Because the concentration of hospitals and healthcare providers are right there. But the globalization of businesses will forward interesting opportunities, because guess what? Video remote interpreting is becoming more and more popular. In many circumstances, when somebody happens to be requiring healthcare services in an area where they cannot find a live interpreter that is trained, and let's keep on talking about that, not just a bilingual person who volunteers to do the job, but an actual trained interpreter, more businesses and hospitals and organizations are going to switch to VRI, as it's called, video remote interpreting, because they know they can get a trained, certified interpreter to provide the services over the net. Talk about flexibility in your career. This is one of the most flexible careers I know of, because most people right now, to this day, that work as interpreters in this country are freelancers, which means you pick your own hours. You can work for several entities. I have many friends of mine who work for a hospital, but they also work for an insurance agency, and they also work for a couple of interpreting companies. So they pick and choose their hours. They pick and choose their assignments. And to tell you the truth, some people don't like to be in the office or in one place all the time, so this gives them the flexibility to travel around, to get in their car, to go to a different place, and to meet different people. For people who require some flexibility because of their family situations, interpreting is the perfect opportunity. I know several people that, because they have young kids and they're the only care providers for their kids, they work while their kids are in school, and then after kids get out of school, then they can provide the care that their children need. And maybe after they go to sleep, they can work a little later and still provide the services. So it gives you a lot of flexibility. Income. The average income 2 years ago, this is from 2015, the average income for an interpreter is $44,000. Now, that's nothing to brag about, but it's certainly above the median income in the population, especially if you consider that at that time, the family income considered median was $38,000. So interpreters were above that average with single providers instead of family providing that kind of income. We expect this to go up because as interpreters grow in preparation, they get more certification, they get more professionalized, they're gonna demand more salaries. To give you an idea, some of the VRI companies out there are paying $24 to $26 an hour, which again, compared to the national average, is pretty decent money. And of course, at higher levels, I know people that work for hospitals that have very good benefits and are in the range of the $50,000 and more, especially if they have administrative duties as well. So Agencies pay different wages to freelance interpreters. And this is something that I'll be happy to answer some questions, but in general, it really depends on A, your level of certification, and B, how good you are at negotiating. But some people pay anywhere from $25 an hour for live interpretation, all the way to $100 an hour for live interpretation. This also depends on the languages. Certain languages command more money than others because, of course, supply and demand. I mean, it's a lot easier to find a certified Spanish interpreter than a certified Chinese interpreter. So for those of you who are not Spanish speakers, this is the opportunity to jump in and get certified ahead of the wave, where you can command more money because you're one of the few certified interpreters in the country. How hard is the certification process? This is something that people ask me about all the time, and they say, well, you know, I've heard that it's difficult to pass, and that's because the test is difficult. Well, let's talk about that for a second. The passing average for first-time takers is about 20%. That's not a lot. But then again, if you think about it, many of these people, when they first started, when this 20% was started to be compounded, didn't even require this 40-hour training. This is a more recent requirement. Before, at the very beginning, people, all they had to prove was that they had some experience. But let's talk about this 20% even today. Why is it that 40 hours is not enough? Because many times, the way that is structured, people take the 40-hour training in 1 week. And then that's it. They're supposed to be ready to go ahead and take the exam. An exam that is pretty rigorous. By the way, I wanted to tell you, if you remember, I mentioned that there's two certifying bodies, CCHI and NVCMI. There's a difference in their examination process that you should know. For CCHI, for instance, you do have to have the 40 hours of training, but when you get to the exam, to the oral examination part, CCHI has a simultaneous portion of the exam. In other words, you will be examining the 3 modes of interpretation as opposed to only 2 in the NVCMI, because they don't test simultaneous interpretation. So there are some differences in the exams, but the passing rate is about the same. Why is it so low? Well, we in our company have been thinking about that a lot, because this is what we do for a living, train interpreters. The reason I'm a trainer is because I discovered there's a lot more people interpreting than people trying to train interpreters so they accomplish their goal of being a certified interpreter. And one of the reasons is because people are not continuing their training. What we have noticed is sometimes people go take these 5-day classes and that's it. They don't do any follow-up, they don't do their work. And what we have discovered is that a much more effective way of interpreting training is by having the 40 hours divided into several classes with some time in between, so people can actually do the work and then have a certified instructor go over their work, give them feedback, and continue building up rather than to try to cram up. Think about it. The 40-hour requirement includes talking about all the main systems in the human body. Try to cram up all those systems, all the anatomy, physiology of the systems in 1 week. It's kind of tough. But if you separate it, we have had a lot of success with our classes being the way we distribute it. So that's why we wanted to introduce you to what we believe is the solution to low passing rates, and that is better education. So it's not only the 40 hours required, we do comply with that. Our company does provide a service that is accepted as a 40-hour requirement by both certifying bodies, but the way we offer it is a little different. First of all, we do this because this is what we believe. We believe that the way to solve this problem is to give you training goals that are attainable with good quality at something that you can afford. Because even though I mentioned that being a certified interpreter is going up in pay, we still think that we need to make it as affordable as possible, because your investment is going to be ahead of the curve. So how do we solve this problem? Is by understanding we have, instead of 40 hours in 5 days, we have 40 hours in 5 months, and we do it online. But one of the big differences that from other places that offer online training is our online training is a synchronous program. Synchronous meaning you always have a live instructor. Every time you take a class with us, the instructor will be there, will be available to you, will facilitate the discussion, will talk about your previous day and homework, and that same class will be recorded for your use and perusal after the fact. So not only do you get the benefit of having a live instructor, you will be able to then review what happened during the class, check your exercises, and continue your progress. We have discovered by simply having this commitment of attending classes once or twice a week, depending on the program that you choose, once you attend the classes and you have the commitment of attending the next day, you create a system that is going to push you with your advance little by little, rather than trying to cram up all of the program in one simple step. And now what I'm going to do is I'm going to open up to some of the questions. I'm sure that Claudia has been writing things down. So let's go ahead with questions.